Welcome, everyone, to the November coaching call. This is Dr. Edward Kondrot, and I want to thank all of you for taking time to join me on this call. And remember, these coaching webinars are for you. And if you do have any questions or particular areas that you would want me to address, be sure to email me or call the office so we can schedule the next webinar. Um, let's see, I think we're getting some interference. Okay. Now, if I'm not coming through or you do have a problem, please either signal to me by writing a question and I'll see that, or you can also raise your hand. There's a control panel on your right. I think it's on your right, but it depends how you have your computer set up. If you're having trouble viewing this online, you can also call and be on the coaching call by telephone. So today we're going to be talking about a very important subject. It's a big part of my program, and that is light therapy. There's a lot of misconceptions about light therapy, and I find it fascinating that more and more research is being done to show that light therapy does indeed have validity in helping to restore health and vision. I'm a fellow of the Syntonic College of Optometry. This is a 75-year-old organization of eye doctors that have used light to help folks restore vision. And I'm also on the board of the International Light Association, which is a European association. They consist of doctors from all over the world that is studying light therapy. So let's begin. Light therapy is really not new. It actually goes back to the ancient Egyptians. They used gems, different colored stones, as healing agents. The Greeks built solariums for the treatment of tuberculosis. And in the 19th and early 20th century, we have researchers Babbitt, Pleasanton, Pancoast, and Dinshaw who used various applications applying color light to the skin, having positive effects. Probably one of the most popular books was written by Dinshaw, and this book is called his Color Therapy Using Tonation, and he used different wavelengths of light to treat the body. Now, in more recent times, we have modern therapies, which consist of low laser application of light. We're all familiar with seasonal affective disorders and the need for white light. And now that the days are becoming much shorter, we're being light deprived. And of course, many of you that live in the northern latitudes, your days are getting shorter and shorter. So we're going to be talking more about each one of these areas. It was in the 1920s that Spittler first started to apply selected light frequencies in optometric practice. And he called this syntonics from syntony, which means to bring into balance. And his model suggested an application of specific colors selectively stimulated the autonomic nervous system to restore balance. And I want to emphasize this, that one of the primary goals in light therapy is to balance the autonomic nervous system. I'm a firm believer that the body does have an ability to heal, and unless we balance the autonomic nervous system, the body is not capable of healing. And by balancing, I mean to get out of the sympathetic state. The sympathetic state is fight or flight. when we're in that stress state, that fear state, certain physiological things take place, and this prevents our body from healing. These physiological things are designed when we're in the stress state, the fight or flight state for survival. So our heart rate goes up, our breathing increases, our pupil dilates, and our digestive processes slow, and healing processes slow or stop because our body is not concerned with healing or digesting food. Our body is concerned with survival. So we need to get out of that sympathetic state. And that's one of the beauties of light therapy. So this is an illustration of the impact of color on the autonomic nervous system. And you can see on the left-hand side, there's the red spectrum of light, which is involved with sympathetic stimulation. Red is putting more energy into the system. The blue end of the spectrum has a quieting effect or shifts the body towards the parasympathetic system. And Spindler felt that green, the physiological balance is green, right in the center is where we want to be. Now, unfortunately, we're always bouncing around from the red end to the blue end. We have stresses in our life that push us to the red end, and then we become exhausted or calm and we go more towards the blue end. So we're always going back and forth. It's when we develop a acute disease process or a chronic disease process, we're shifted more and we're locked into a certain end of the autonomic nervous system. And this is where light therapy can be very valuable in helping us to unblock this state and to get us more in physiological balance. So I want to emphasize that the key is physiological balance. We want physiological balance. When we achieve that, our body is able to heal. Now, in syntonic phototherapy, and those of you that have been through the Kondrot program and have been evaluated by me, one thing that we look at is your pupil response. I shine light into your eye under my magnifying microscope called a slit lamp, and I look at the size and stability. The pupil corresponds to your autonomic nervous system. When your pupil is dilated, that means that you're in the sympathetic state. When your pupil is constricted, that is more of a parasympathetic state. Now, many of you, as you get older, your pupils are smaller, and it actually implies that you have loss of sympathetic tone. They seem kind of contradictory, but many of you have been in the sympathetic state, the fight or flight, for so long that you are developing adrenal fatigue or a loss of adrenal cortical hormone. So you're not able to get into the sympathetic state. So in some cases, we have to put energy into your system. So we learn a lot based on your pupil. And there's a high incidence of correlation with physiological, functional, emotional stress, trauma, metabolic, or endocrine dysfunction, simply by looking at the pupil. So the examination of the pupil is a very important part of understanding the autonomic nervous system. Now, I want to talk about the models for the action of light therapeutically. So, we're just not talking about the autonomic nervous system. Light has an effect on the atomic level, cellular level, hormonal, and the autonomic. So we're going to go into a little bit of detail in each one of these areas, which is really fascinating. So let's look at the atomic level. All chemicals have a specific light absorption and emission characteristic. When I studied chemistry in college, we would look at the spectral emission of different elements, and each element when stimulated, would produce a certain wavelength of light. And this is due to the electrons changing excitation states. And this change in excitation releases a quantum of energy, which is a photon or an electron or light. So these narrow band filters restrict wavelengths and hence available quanta to be absorbed by the cellular content. So not only do these chemicals give off certain specific wavelengths of light, they're also able to absorb certain specific wavelengths of light. So there tends to be a resonance or a harmony with every atom in our body related to light. So we are composed of light energy. So every molecule and atom in our body can receive light, give off light, and communicate with light. So this is one mechanism how light affects the atomic level. Now the cellular level, which is more interest of mine because this is the level that we're trying to strengthen and stimulate for healing and regeneration. Dr. Ott recognized that there's a flow of cellular protoplasm in organelles in plants which are altered by stimulation of different wavelengths of light. So by shining these different wavelengths of light and observing plant structures, you can actually see cellular movement and changes in the plant. They recognize different wavelengths of light. Probably one of the most interesting researchers is a Russian by the name of Dr. Tina Kuru, and she researched the effect of light on actual cell metabolism. In fact, she identified certain cellular elements in the electron transport chain and showed that light actually stimulates energy production in the cell. So the light that we receive that hits our body has the ability to stimulate the energy of a cell in terms of its function and regeneration. Now, she also researched that specific frequency of light aided the healing of wounds. And when we do have a wound or ischemia or inflammation, cells are characterized by acidic, hypoxic, and an inhibited state. So light, and she's demonstrated this in the laboratory, drives them more towards oxidation, a balanced pH, and vitality. And this effect is maintained following light therapy. So those of you that have macular degeneration or glaucoma and you're doing your light therapy and you're wondering what's going on, well, the cells in your retina, when you have macular degeneration or any eye disease, are hypoxic. They have low oxygen. They're acidic. They don't have a good pH balance. And they're in an inhibited state. So light therapy drives them towards this healthy state of balanced pH and vitality. So light is actually hitting those individual cells in your eye when you're doing light therapy to help stimulate regeneration and healing. And this was demonstrated, numerous scientific studies done by Dr. Tina Kuru and published. Low-level laser therapy is becoming of interest, and it's also called the cold laser, where there's been several articles published showing that it can be useful in the treatment of macular degeneration and glaucoma. Particularly, there was a study that was published in Berlin, Germany, with a series of macular degeneration patients in glaucoma, showing that the cold laser or red laser helps in regeneration. The cold laser is also used by dentists following oral surgery. It's also used by athletic trainers for musculoskeletal disorders, but the cold laser or red laser is a low-level laser which is used to stimulate healing. Now, the interesting thing is Dr. Carew's work demonstrated that there is no need for coherent light, which is a laser, that normal light is equally as effective. And this was really a surprise to me because everyone thinks that coherent light, the laser light, is more powerful. It helps generate the energy source, more precisely to the cellular level. But Dr. Tina Carew showed that there was absolutely no difference. The only difference is that the cold laser may have a deeper penetration. So if you're treating a musculoskeletal problem and you're going to go deeper into the tissue, the cold laser may have better application. But for our work in helping to restore vision, it seems like there's absolutely no difference between the cold laser and coherent light that you are receiving with the symptomatic light therapy. Now, those of you that have had the cold laser in our office know that we have you close your eyes during the light treatment because it is a brighter light and it can be more phototoxic. But it does penetrate through the closed eyelids, the energy. The coherent light, the non-coherent light that is administered with the symptomatic light therapy with your halogen light bulb and your glasses is a lower level illumination, which penetrates directly into the eye, hitting the retinal cells. And on the left is a photograph of Dr. Tina Carew and myself. And this was taken at the International Light Association meeting that was held in Montreal last year. And this is her book, The 10 Lectures on Basic Science of Laser Phototherapy. She's a brilliant researcher, which is really bringing scientific validity to light therapy because many traditional doctors feel that there is no hard science behind light therapy. And I'm telling you that there is a lot of hard science, studies done in the laboratory, which clearly demonstrate that light therapy has an effect on the cellular level. Now, we talked about the atomic, we talked about the cellular. Now let's talk about the hormonal. Well, it stimulates the choroid. The choroid is a highly vascular structure in the back of the eye. And when you look at light with your glasses on, it's going into your eye, it's exposing your blood directly to the stimulation of light. Now, the blood is composed of hemoglobin and bilirubin, and this is the counterpart to chlorophyll and phytochrome, which is the light-sensitive pigments in plants. Now, we know that plants need ultraviolet light. They need a wide spectrum of light in order to survive. And the key element with plants is chlorophyll. Now, it's really interesting that hemoglobin, which is a key component of blood, is very similar to chlorophyll structure. And both are reversibly altered by light. And here on the left is a hemoglobin molecule, and on the right is a chlorophyll molecule. And you can see they're almost identical in structure, except for the central element. In hemoglobin, it's iron, and in chlorophyll, it's magnesium. So when we do our light therapy, the hemoglobin and blood element is being exposed to the light through the transparent membrane of the retina, hitting the choroid. So Spindler observed that colors can selectively stimulate the autonomic nervous system. Red and green systems interact with the sympathetic, blue and yellow with the parasympathetic, and numerous central nervous system structures are stimulated by light entering the eye. Now, one thing that we do when we evaluate you, we do a particular type of visual field tests. And in the office now, we're doing the computerized visual fields, which you hold a control button. When you see the light flashing, you hit the buzzer, and this gives you a computerized image. But we also do movement fields and color fields. These tend to be more reflective of your physiological state. I call them fields of awareness because we're designed to recognize motion in the periphery. And we need the awareness of color to process information. So the color visual fields, the white or the movement visual fields, those of you might recall when you were getting your visual fields taken, we want you to first detect motion, and then we want you to then detect color. The color is informational processing. And this is the level of processing detailed information of your cognitive system, the capacity to integrate information. It's interesting in your eye that you have code elements to detect red, green, and blue. So when we're doing a visual field test, we're measuring the sensitivity of those code elements, and then we're also able to follow your treatment to see if there's any change in the ability to recognize those elements. So when your cones become healthier, the red cones, blue and green, your color visual fields will expand. And this seems to be one of the most sensitive indicators of the success of treatment because we're subtly stimulating the function of these cone elements and we're able to measure their response. Now, another added benefit of color therapy, remember we talked about we're trying to balance your autonomic nervous system. So typically people become calmer, they're sleeping better, deeper and longer, they're more aware of their own and others' feeling, and are more aware of the environment. And a lot of this has to do with expansion of the visual field. As we stimulate these code elements and they improve their function, you become more aware of your environment and your autonomic nervous system becomes balanced. Now, we do have treatment options based on the type of condition that you have. So not only do we look at where you are in your autonomic nervous system, whether you're in the parasympathetic or sympathetic, but we also look at the type of disease, and typically an acute disease. A recent onset of pain or inflammation, like if you have a macular hemorrhage, a bleed in your eye, sudden onset of glaucoma, we want to quiet the eye with the parasympathetic end of the spectrum, and we use either violet or turquoise or the blue. Most people that I see have chronic and long-standing, it's an embedded condition. And because it's long-standing and chronic, they tend to be sympathetically depleted. So we want to gently treat more towards the red end. Now, I don't want you to think that if we treat towards the red end, we're putting you in a sympathetic state or a stress state. No, we're gently adding energy into your body so your body will be able to become stronger and be able to heal. So in the office, we use various treatments which comprise at looking specific colored light or a sequence of colors for a specific period of time. Hope-based treatment uses a small 15-watt halogen bulb and especially tinted glasses, so you can do the treatment at home. And typically at home, we want you to do it either once or twice a day. Uh, and sometimes it's only necessary to do it every other day or once a week. A lot depends on your eye health, your overall uh, autonomic nervous system. So there's many, many different factors, but generally we like you to do the light treatment at least once a day. Now, in addition, the syntonic phototherapies has had remarkable success in learning the ways children with learning disorders. As I mentioned, it has very good results with age-related macular degeneration in terms of cellular revitalization, reducing edema. Also, it has an application in traumatic brain injuries, amblyopia or lazy eye, and binocular dysfunction. Dr. Jacob Lieberman, who incidentally, next year he's going to be coming to the Florida Wellness Center to give a special weekend workshop. So I'm really excited. Dr. Lieberman lives on the island of Maui in Hawaii, and he's going to be coming to Florida for a special weekend. So you might want to give the office a call, and we're going to be firming up his schedule. It's going to be a wonderful weekend workshop. So Dr. Lieberman did a study, the effect of syntonic colored light on the stimulation of certain visual cognitive functions. And he examined the effect of syntonics on visual field size, memory for objects, memory for abstract symbols, auditory memory, speed and accuracy of saccades, which are eye movement. And he studied 18 patients and 18 age-matched normals. And the colors were chosen basis on the clinical evaluation. So this is the result of the study. The group that had light therapy had over a 2,000% change in their visual field. The control had only 14%. But my goodness, there was such a statistical difference that the light therapy did have a remarkable difference in the visual field. And he also studied visual memory, and this was a Detroit test of learning aptitude. And the experimental, the group that had light therapy had a 50-month increase in learning ability compared to the control, which had 13. So as your visual field expands, you're able to retain more information. So even though this study was done in children, those of you that are senior citizens and you're having trouble with your vision and memory, I'm suggesting that light therapy not only will expand your visual field, but also improve your memory. This is another parameter, visual memory using abstract symbols. And you can see the experimental group had a significant increase compared to the control. Auditory memory also had a increase. I don't have the slides cut off at the bottom. So here's some books if you want to read more. In particular, the second book, Light Medicine of the Future by Jacob Lieberman, is a wonderful book, a good introduction to light. The Syntonic Principle is a more academic book by Harry Spittler. And I'm sure that if you read Dr. Lieberman's book, you're going to be very interested in attending his workshop, which is going to be coming up next year in February at the Eye Center in Florida. So here's some of the syntonic light therapy colors that we use. Probably the most common one is mu delta. This is for chronic syndromes, for physiological and toxic states, chronic imbalance, but the key is chronic, something long-standing. So long-standing dry macular degeneration, long-standing glaucoma, long-standing dry eye. Then we have the mu epsilon, which is the second most common. This is more for acute conditions like a macular hemorrhage or something that comes on rather quickly in the acute phase or early phase. In some cases, we add a second color if we want to stimulate the body more. So some of you may be receiving alpha omega, which is for more of an emotional balance, or alpha delta to stimulate the body more. But generally speaking, we like to start off with only one color therapy and see how you progress, and then we could add a second color. These are some publications related to light and glaucoma. I published a paper, Homeopathic Syntonic Light Therapy in the Treatment of Glaucoma, which is published in the Journal of Optometric Phototherapy. And believe it or not, there were 2 articles published in the American Journal of Ophthalmology, which is a peer-reviewed traditional Western ophthalmology journal, which showed that light therapy can have a positive effect on glaucoma. And here is an example in our office of patients undergoing syntonic light therapy. I met a really interesting individual, Dr. Christian Agripar, when I was in Belgium. He's a brilliant French color therapist. He's a medical doctor, psychologist, a biochemist, and he's one of the leading color therapists in France. And I was very intrigued with his approach and I'm planning to do some studying with him because he has a unique approach using narrow bandwidths of light treating acupuncture points. This is a photon stimulator. This is a new addition to our office, and this machine generates very narrow band wavelengths of light, and we're using this to stimulate acupuncture points. We're using it to stimulate directly into the eye to see if we can get an added effect with color therapy. And here's some acupuncture charts, and you can see that by applying light therapy to different acupuncture meridians, you can stimulate the body. So it's not only necessary just to stimulate the eye. Light therapy can be used to stimulate acupuncture meridians. Probably one of the leading researchers in stimulating acupuncture meridians is Dr. Peter Randell, and he developed a whole series of treatment called color puncture. I've studied with Dr. Randell in Germany and Greece and have really looked at his therapy. And certain colors are related to different organs. This is the device he uses. It's called a color puncture, where you have different lights and a glass probe that you use to actually stimulate the acupuncture meridian. And he has various very sophisticated treatment programs. On the left, you see ear points. Ear points are very sensitive in acupuncture for treatment. And on the right, we have iridology meridians. And I've developed an interest in using these iridology meridians to help treat eye disease. One of the latest treatments that we're doing, just again to remind you the similarity between hemoglobin and chlorophyll, this is called ultraviolet blood irradiation, where we actually take blood out of the body and we pass it. At the bottom there is a ultraviolet filter. We pass the blood through this ultraviolet light, and the hemoglobin molecule actually then absorbs this ultraviolet light. It stimulates the hemoglobin, which then goes into the body to help revitalize every organ that the blood touches. So those of you that are interested in learning more about light therapy, I would highly encourage you to attend the annual Syntonic meeting. This coming year, it's going to be held at the Dolphin Beach Resort, St. Petersburg, Florida, in May of 2014. This is a wonderful meeting. It's actually one of my favorite meetings of the year. And there's a wide variety of people that attend, not only eye doctors, but patients, psychologists, healthcare practitioners, and people are just interested in learning more about light. It's a wonderful meeting, and it's a lot of fun. So I'm going to now entertain questions, and you're always welcome to send me a question before the webinar so I can address it. And we did have a question that was sent. This is regarding light therapy and microcurrent, that the instructions were changed to mid-afternoon back in late February. And why is mid-afternoon so beneficial? Can I do these programs either in the morning or in the evening? Well, let me clarify. The microcurrent programs can be done in the morning or the evening. I recommend that you do your eye program at night before you go to bed, because this is when the eye regenerates. When you're sleeping at night, it regenerates. So the healing microcurrent energy might be more beneficial right before you go to bed at night. Now, in terms of the light therapy, I've changed my instructions because of the dangers of adversely affecting the circadian rhythm. I think it's important that you do the light therapy during daylight hours. And I know that it gets kind of tough with the shorter days in the winter, but I would avoid or limit doing the light therapy at night. Professor Abraham Hayam has done some research to show that unwanted light at night can contribute to various diseases, various cancers, and eye problems. So, based on his research, I am not recommending that you do light therapy at night. In fact, at night you should limit your exposure to light. Professor Hayam showed that the blue light tends to be more detrimental at night. We need blue light during the day, but we should avoid blue light at night. There's a question also. Please review the purposes and when to use the several programs on the frequency-specific microcurrent. Is lead notoriously a resident in the macula? And why is there a lead detoxification program? Well, most of you have several programs on your microcurrent machine. You have your eye program, and then you have your body programs, which consist of the detox, the stress, and the brain and sensory. I recommend that you do the eye program once a day, and then you can do either one or all of the other programs once a day in addition to the eye program. Now, lead toxicity is an epidemic. It's rare for me not to see somebody with eye problems and not have elevated lead. So that's one of the reasons why we put the lead detox program on your machine. And yes, lead is concentrated in the neurological tissue and the eye. And so this could be a reason why, as we get older, we develop macular degeneration. There was an interesting study done that showed as we get older, we develop weakening of our bones and osteoporosis. And when we're younger, there's evidence that the lead is stored in the bones, but as we develop osteoporosis, it's released and then it goes into the neurological system. So this could be one of the reasons why we develop eye problems as we get older. But there's no question, Harvard studies have been done to show that elevated lead is related to cataracts, macular degeneration, cardiovascular disease. So that's a whole other topic that it is essential that you eliminate the lead. Now, the question is the lead detox program a standalone? Will that remove all my lead? And the answer is probably not. I'm in touch with some naturopathic doctors in Arizona who are doing microcurrent frequency specific using these frequencies, and they have demonstrated that there is some release of lead into the body and elimination of lead. But if I do think if your lead is elevated, it is essential that you begin some type of chelation program. All right. Any other questions? Let me see. Somebody has their hand up. Now, there's two ways that you can ask a question. You can raise your hand, and I'll click on the unmute button. And Rachel, your hand is raised. Do you have a question? Okay, I guess she doesn't have a question. So there's two ways that you can ask me a question. One is you could type your question, and then I'll respond. Or you can raise your hand by clicking the hand button. Now, this webinar is being recorded, and I'll be emailing you a copy of all the slides and also the webinar. So if you're interested, you can listen to it again. So last call for questions. Once again, if you do have a topic that you would like me to discuss for the next webinar, these coaching webinars are the first Monday of every month. And I haven't selected the topic for the next webinar. There's a question, would you repeat the light therapy again? The whole webinar will be sent to you so you can watch it again. A question is, I once reported a floater in my eye while doing the frequency-specific treatment. Could the lead detox be the reason for the floater and not the best program? Well, that's really hard to say. It's unlikely that the frequency-specific caused the floater. It could be another reason. And once again, the frequency-specific lead program is a very gentle program for detoxification. And I don't think that that was the cause. Very good question. What are the indicators that I should look for or know when the light color should be changed? And that's the importance of doing your follow-up. It's not that common that we need to change light therapy, but certainly if your condition is declining, your vision's getting worse, then we may want to boost the light therapy. Or if your condition changes, let's say, for example, you go from wet macular to dry, or you go dry to wet, or you develop a new problem, then we might want to change the color therapy. But typically, it's not that common that we're changing color therapy. It's more common that we're adding a color, maybe to strengthen you later on. And another question, can blue block glasses protect against the effects of artificial light? And I recommend a good question. I recommend that the blue block glasses be used at night, the blue blockers. We need blue light during the day. We should avoid blue light at night. And that goes contrary to many eye doctors. Most eye doctors want you to wear blue blockers during the day. And I'm saying you need blue light during the day, but you need to avoid it at night. This is based on the work of Professor Hayek. So the blue blocking glasses can protect against the ill effects of artificial light at night. But that depends on the type of artificial light because fluorescent light bulbs have a different spectrum. Most of the fluorescent light bulbs are more towards the blue end of the spectrum. So it's even more important to protect. Question, should the gloves be placed still over the eyes as in, because we're trying to remove the lead from the macula? Well, when you do a detox program, you're not removing the lead from the eyes, you're removing it from the body. Remember, lead is stored primarily in the soft tissues, in the fat, in the bone. So I don't recommend that you do the detox program by putting the gloves on your eye. I recommend that you do it by putting it over your abdomen or holding it in your hands. Now, in your eye program, you do have a detox frequency. So when you're doing your eye program, macular regeneration or glaucoma, there are frequencies in there to remove lead from the eye. The detox program that is on program number 2 or 3 on your machine is primarily for a body detox. There are no frequencies in there for your eye. So I do not want you to do that program by putting the gloves over your eye. The frequencies are more geared for the bone, the fat, the liver, and the kidney. So it's not appropriate to use the detox program on your eye. The question is, can I do the light therapy at bedtime after the micro program earlier in the PM? Well, I do not want you to do the light therapy at night. So if you're going to bed and the sun is still up, you can do the light therapy. But avoid doing the light therapy when it is dark outside because I think it interferes with your circadian rhythm. Light therapy should be done when it is light outside. So it can be done anytime during the day when it's light. I've been doing my light therapy early in the morning. Is that okay? That's fine. That's fine as long as you get up early in the morning and it's light outside. But if you're getting up early in the morning and it's dark, don't do the light therapy. But I think if you have a choice between doing the light therapy in the morning when it's dark or at night when it's dark, it's much better to do the light therapy in the morning when it's dark because you're resetting your pineal early in the morning and you need to be exposed to light. So avoid doing the light therapy at night when it's dark, but if the only time to do it is in the morning when it's dark, you're much better off. Okay. Looks like there's no more questions, and I want to thank all of you for participating, and I look forward to our next coaching webinar, which will be the first Monday in December. Please send me some suggestions or call the office for some suggestions of a topic, because this is a time that you can get some additional information that will help you understand your treatments better and to have you get a more positive effect from the microcurrent and from all the light therapy and all the other alternative treatments that you're doing. So I want to thank all of you for participating, and until next month. I hope everyone has good health and clear vision.